Hello again, and welcome to Facebook Live. I'm Chris Stauffer. We're with Dr. Shanu Kothari, and we're going to talk about a couple of different things, but really one of them is a novel approach to acid reflux. But first we should talk a little bit, I think, about maybe set the stage for what acid reflux is.
Yes. So acid reflux, or gastroesophageal reflux disease, GERD, if you will, most commonly presents with a complaint of patients what they feel is heartburn. That burning sensation here, or often regurgitation. They literally feel contents coming up from their stomach into their esophagus. And acid is not the problem. Acid is good. It's designed to be in the stomach. It's when it comes through the valve between the esophagus and stomach and splashes up into your esophagus or your food tube that you begin to feel these symptoms. And it ranges from very minor and self-limiting to people who it's a challenging problem every day of their life that even with escalating doses of medications are still having trouble, which is where we come in as surgeons as some surgical alternatives now to this daily problem that patients face.
So the daily problem can be as simple as some people have that, as you said, maybe they have orange juice, something that is acidic and triggers it, but that's not what you're really referencing. What you're talking about is something that's more consistent. It's
patients
daily.
With very debilitating symptoms where it truly impacts their quality of life. Maybe they're on pills, maybe they're escalating doses of pills, they're having breakthrough symptoms on these pills, maybe the pills aren't working or they're too expensive or they're having side effects of these pills and are looking for a more durable, long-term solution to their problem.
All right, let's talk about one of those new solutions. I shouldn't say new, it's been around for a while. Maybe novel approach is the better way to describe it. So I guess the question is, what is LINX?
LINX is an innovative treatment for acid reflux. Now, we've had a surgical treatment for decades where we take the top of the stomach and wrap it around that valve to strengthen that valve or augment that valve to prevent acid reflux. The trade-off is we can't control that valve in terms of how much pressure we're doing when we wrap the stomach. So sometimes it works too good.
Okay.
Prevents patients from, it makes a great valve, but some people cannot belch or vomit afterwards. And so it causes some side effects of gasiness or bloating, what we call gas bloat syndrome. LINX is a very innovative procedure where it doesn't overcorrect the valve, it just brings it back to baseline. And the novel thing about the physiology of magnets is when we played with them as a kids is when they're closer together, they're stronger.
Magnets. These are magnets. Okay, all right.
It's a ring of magnets. And the beauty of them, like we said, when we play with magnets typically as a kid is when they're closer together, they're stronger, and when they're farther apart, they're weaker. Well, it's a brilliant, innovative way to strengthen a valve because when you're not eating, the magnets are closer together and they're working, and then when you eat and the food passes through, they separate and get weaker to allow the food to pass through before they collapse back down and strengthen that valve.
Now, you actually brought the LINX ring. It's on your finger. I want you to show what that looks like because it's small, but it fits right around your ring finger.
Yep, and we literally do that during the procedure. It's a minimally invasive procedure, what we call laparoscopic surgery, but we actually have a sizer and we size the esophagus because everyone's is a little bit different. But once it's placed around the esophagus, it's about the size of your finger. And again, it has the ability then to expand and then to contract back down to help the valve effect to prevent acid reflux.
So because it's minimally invasive, it seems like that's not only an easier procedure, maybe safer. Is that safe to say, or quicker?
It can be, depending on the anatomy of the patient, but the majority of these procedures are now done in an outpatient setting, meaning same-day surgery. So you would come in the hospital, have the procedure done, and the majority of patients are able to go home the same day.
Okay, and how quick does that work then? I mean, are you noticing a difference within days, hours?
Excellent question. Most patients notice an effect right away. So literally, if they typically are lying flat at night and wake up with some heartburn or regurgitation in the morning, it'll literally be gone the next morning. They'll be noticing the effects that quickly.
All right. We're talking with Dr. Shanu Kothari about the LINX procedure. Many people who have acid reflux disease certainly want to learn more about this. How do I learn more about this? Do I need a referral?
Well, it's always good to start with your primary care doctor to make sure to see if we really have the disease correctly diagnosed. Other things can cause those symptoms as well. But regardless of whether you work with your primary care provider, there are websites available, including our own, that you can learn more information. But there is a workup that has to be involved, of course, to make sure any patient is a candidate for any surgical intervention. So all patients would need a upper endoscopy, the lighted camera looked in the stomach to inspect the area and look at the severity of damage. And then we will, most often, we have to do a test where we quantify or see how severe the acid reflux is prior to surgery, correlating that with your symptoms. And then if your surgeon, he or she feels that you are a candidate for the procedure, then it's a matter of insurance process, getting approval, and proceeding with surgery.
How common is this procedure used both in our area and nationally?
We were fortunate to be in the original trial done in the U.S. So out of the first 100 patients done in the U.S., we implanted 8 of those patients here at Gundersen. So we're really getting, it's been longer in Europe, but we're in the U.S., we're getting some mature data now. I mean, those patients are, 6 and 7 and 8 years out now. So we were the first in the region to offer it, and it's definitely growing. It's growing in this area. We're certainly seeing patients, unlike in years past, that are coming in, they've already done their homework, and it's like, they've done their homework, and they're like, this is what they want. Again, because the vast majority of patients can belch through it, could vomit through it, and so they see that as a favorable in terms of the trade-off for increasing the strength of that valve.
Yeah, versus the other surgical procedure.
Still a great procedure.
Yeah, right.
Each has their own trade-offs. I mean, the one this is a foreign body, so it's implanting a foreign body. There's some inherent risks involved with that. The other one, there's no foreign body involved with it. But like I said, it almost works too good in some folks.
Side effects?
Yes. So this is like we talked about, this is a foreign body that is implanted around the esophagus, this ring of magnets. So your body wants to wall it off, just like it would with any foreign material, whether it was a mesh from a hernia repair or a knee replacement. Your body wants to create a capsule or wall it off because it doesn't recognize it. Well, the trade-off is that when that wall of scar tissue forms around the device, it can cause the sensation of food sticking. And so the advantage of this device is you go home on solid food right away. We want you eating regular meals. But much like a knee replacement, we don't want that joint to freeze up by non-use. We want you working it and exercising and rehabbing it. We want you to do the same with this device.
So
and the way you do that is solid foods right away.
Yeah.
And every hour while you're awake, have a bite of something to actually actuate the device. We need it opening and closing so that the scar tissue naturally wants to form around each individual bead, as opposed to like a piece of duct tape around the entire device, keeping it from wanting to work and limiting it. So don't give in to that sensation. Actually power through it with your meals. And so that's actually part of the healing phase. It's very natural. So just to warn patients ahead of time that, when you get through that honeymoon period and after the first couple of weeks when your body's starting to form that scar tissue, that's a natural byproduct of the surgery.
So you're saying a side effect is that you have to eat solid food.
Well, yeah. Choose wisely.
All right, that sounds great. If you want to learn more about this procedure, you mentioned the Gundersen Health System website. Lots of information there, and we invite anybody to certainly check that out. Again, it's the LINX procedure, common in the United States, or becoming more common in the United States, and certainly common in Europe. And Dr. Kothari, we thank you for your time.
Thanks for your interest.